Okay, so now we are talking about the management of PCOS, and that has a big fat "it depends" attached to it, because it depends on what the patient's presenting complaint was. So often it's going to be cycle control, in which case you can give the pill to regulate the cycle, provided that the pill is safe to give to this person. You can give the injectable progesterone or the intrauterine device with progesterone. So the COC will cause regular shedding of the endometrium, and that protects the endometrium from becoming cancerous. And these two will just completely thin down the endometrium and render this person amenorrheic by design. And that also protects the endometrium because it's not just randomly proliferating without regulation. Okay, if infertility is the issue, one of the most important things is weight loss, which is really awful because patients with PCOS really struggle to lose weight. But if you're going to refer, and you probably will need to refer if it's a fertility issue, our reproductive medicine unit does not see women with BMIs of over 35 because the success rate for whatever intervention is so much less. What is this all about? Well, adipose tissue secretes estrogen. So if you've got a lot of extra adipose tissue, it's like you're wearing a giant extra ovary and it's making a lot of extra estrogen, which contributes to the issues around the reverse ratios of the hormones. So weight loss is very, very important. Just by getting the BMI to normal, that in and of itself can regulate the cycle. So that's also something that links in over here. Now, if there's a cycle issue, but there's also an infertility issue, what you can do, or what we do, is give cyclical Provera. So a woman will have Provera for about 2 weeks of every cycle. You're trying to sort of mimic the LH surge. This is not contraception, but it can regulate the period, so that's an option for there. Then we've got the aesthetic issues. So the hirsutism and acne can be really quite disfiguring. So where available and where possible, which in our system it's not, laser and waxing for the facial hair. Diane is a very good, it's used for acne, so it's got very good anti-androgen activity. So that's always something that you can use for acne. As sometimes a normal COC will work for acne, but Diane is very good with someone who's got increased androgens. And then, of course, the metabolic syndrome, we all know, lifestyle management, metformin. Now, metformin can be very useful in trying to help people lose weight. So we don't necessarily only give it for those who've got diabetes. So that is something that is a possibility. And then antihypertensives and statins, obviously. And you'll be amazed at how young the patients are who already start with hypertension and type 2 diabetes because they've got PCOS. So that is it. And now we have, I just want to focus this nicely. I'll take a picture of it from above. In fact, let me kind of do this. We have a giant ovary that's got lots of different follicles in it. I just thought that was a nice little way to design this teaching slot. So there you have it, PCOS on a stick, and I will take a picture of this and put it up for you as well.